Welcome back. You're still watching KUTV Primetime News, and as I promised you, we have come back with an interesting conversation that revolves around wild animal protection. That's just the umbrella of the things, but we have something very interesting that is called antimicrobial. Depends on where you went to school. Antimicrobial resistance. And with us we have Dr. Victor Yamo, who is with us tonight to help us understand what exactly this is and how to go about it. Dr. Victor Yamo is the Farming Campaigns Manager at Wild Animal Protection. And just before I get to welcome him to give us an insight on what exactly he does and what this AMR is, just some background information, where each year from the 18th to the 24th of November, the world celebrates World Antimicrobial Awareness Week, and this year it was renamed to World AMR, which is our topic of discussion tonight. World AMR Awareness Week, and both acronyms of both names, the previous one and this one, is WAAW. When you say it, the word sounds like wow. So he's going to tell us if that's how they say it. And of course, this campaign and the decision to change this particular name was to necessitate the need for a more appropriate term for encompassing the actual virus in this particular system, which is that resistance. And that's the reason why it became now World AMR Awareness Week, which is antimicrobial resistance. So welcome, Daktari, to the show tonight.
Thank you, Mutegi.
So let's begin here. Where I'm talking too much science, and maybe someone is wondering, antimicrobial. What are these things that we are calling antimicrobials?
Antimicrobials are simply drugs or medication that is used to treat infections that come from microbes. Microbes are tiny, small organisms, and there are various categories. I think the most common is bacteria. So under antimicrobials, we have antibiotics, which treats bacteria. We have antivirals, which treat viruses. We have antiparasitics, which treat parasites. And then we have antifungals, which treat fungal diseases. So the idea is to encompass all of them, and as you rightfully pointed out, is to bring all the diseases that are infectious together, and the fact that there are drugs that are used to treat them that are slowly or over the last couple of years have been developing resistance, which simply means the organism is resistant to the drug that we are using to treat it, and that leads to serious consequences in medicine. All right. Yeah.
Just before we talk about the resistance of the same, allow me to ask, Wild Animal Protection, if we go back to our science class, we are animals, right?
True.
So is this Wild Animal Protection just catering for domestic animals, domestic plus wild animals, or domestic wild animals plus human beings?
A very good question, Mutegi. We cater for everything.
Okay.
Yeah, and let me explain. In 2021, we developed a new strategy that is running from 2021 to 2030. Previously, we were known as World Society for Prevention of Cruelty to Animals, WISPR. But then about 2013, 2014, we became World Animal Protection. But over the years, we have then realized that you cannot protect animals, or if you protect animals well, you then have impact on protecting other sectors. You can then protect humans, because what humans eat or consume from the animal perspective, if they are from animal production, if it's not done well, you end up in a situation where the humans then end up with challenges, as we'll see with the AMR. We can also protect the environment by taking good care of the animal. And I know we are right at the beginning of COP28 in Dubai, and it's about climate change. Science is now telling us climate change happens and is contributed to because of how we manage our animals. So essentially, as a World Animal Protection, we have two big thematic areas or goals that we work around in. We work around the global food systems, where we are saying that we need to change the global food systems and ensure that the animals that are within the global food system are catered for and their needs are met. Because if you don't do that, then you have challenges. But we also work around wildlife, where we are saying that we should stop commodifying wildlife and making them commodities, and ensure that wildlife is then catered for. And we say as an organization that wildlife are best left to be in the wild, and if we need to see them and interact with them, we should allow them to be in the wild, where they can express their natural behavior and be who they are naturally. Yeah.
All right, thank you. That's profound.
Yeah.
Let's go to I called it the virus in the system. Allow me to use an animal term, the elephant in the room.
Yeah, okay.
AMR.
Yeah.
What is this? What is this resistance, and how does it unfold, and what causes this particular resistance?
Okay, I see that's many questions in one.
In one, yeah.
But I'll try and answer all of them as simple in the simplest terms possible. AMR and antibiotic, let me say, antimicrobials are supposed to either suppress the disease-causing organism or kill them. Now, what is happening over the last couple of years is that antimicrobials are the disease-causing organisms, the bacteria or the virus or the fungi or the parasites, are beginning to become resistant to that dawa. And what we are saying is that over a period of time, because of misuse, overuse, underuse, or how we are managing our drugs, we are ending in a situation where what could be treated, the common diseases that could be treated easily, you fell sick, we gave you a shot of something and you got cured 3-5 days later, 7 days max, is no longer working. And so the signs that we are seeing that it's no longer working is, one, it's taking us longer to treat infections using the same compound. So an infection that would be treated in 3 days or 5 days is taking a longer time, maybe 7 days. Some you need to repeat. We're also having situations where the infection is recurring. It's coming again. You have a problem this week, we treat it, you finish the dosage, but 2 weeks down the line, it happens again, and we need to give you a stronger medication, or alternatively use a higher dose of the same medicine. So that's what we are seeing. But the world has then done some research, and there are pieces of research papers that you can see here and there. The most profound one is a team in the UK in a journal called Lancet in 2019 then said that if we continue using medications or antimicrobials the way we are using them or misusing them, and we do not change certain things in our systems, currently, we are having about 1.27 million people dying annually because they are getting infections that can no longer be treated by the compounds we have. If we do not change what we are doing, by 2050, we'll have 10 million people dying annually. And in fact, now we are starting to say AMR or antimicrobial resistance is a silent pandemic. And if you compare those figures I've given you with what happened during the COVID pandemic, you realize that by 2050 the number of people dying will be almost double. In fact, we are now currently being told that antimicrobial resistance is causing deaths, which is higher than what we are seeing in some of the common diseases that we've been talking about. And that's why the world then in 2017, 2015, 2014, 2015 came together and said we need to look at this thing and start developing strategies to manage it, because if it's allowed to get out of hand, we'll then have problems. And then in 2017, thereabout, as a country, we then developed our first policy for containment of antimicrobial resistance, and then we developed the first work plan that ended last year, and this year on Monday last week we launched the second work plan. So essentially we are saying we need to look at how we are managing medications so that they can work for us longer, and so that the we reduce the development of resistance to these dawas by the organisms that they are supposed to treat.
All right.
Yeah.
We have 1 minute before we go for a break, but I want to ask you a very quick question and a very fast one at that. You mentioned something about the chemicals, the chemical compounds that are there so far. Does it mean we researchers need to go back to the labs and invent something?
Okay, let me clarify that. When I say chemical compounds, the drugs that we use can be natural products or synthetic products. They can come from, if you remember the story of Fleming, penicillin. Penicillin actually comes from a fungus. So the reality is that we are not developing these products as fast as we need to develop them to counter resistance. And so what we need to do is to use what we have currently prudently so that the resistance does not develop as fast. And then the other thing we've seen is that the products that have been developed recently are getting resistance a bit faster because, again, of mishandling them or misusing them. And that is something that then we need to discuss and engage around.
Why is it such a big deal? Because anytime we talk about world something, I mean, it's a big deal. I know you've painted that picture. I want you to add more color to it on why it is such a big deal, this wow.
Yeah, thanks, Mutegi. The reason why it's a big deal is the fact that, one, we are not developing any new products as fast as we need to. And two, we are getting ourselves into a situation where certain patients are getting sick and there's nothing we can do as medical practitioners, or from the animal side, there's nothing we can do to help the animal because there's no compound that can treat the ailment that they are suffering from. And so the world decided that, one, we need to raise awareness because there are certain things that we can do at the individual level that can reduce the spread of antimicrobial resistance. It's not major things. And so that's why it's becoming a big thing. Then, of course, the magnitude and the costs, because if we have to treat you twice or 3 times to get rid of an ailment, we must also treat you with a stronger medication for that, which is more costly. The impact of that on our health, the cost in our health system is also quite enormous. So we need to find mechanisms to manage diseases in such a way that they are not costing us, because if you look at our health budget, a big chunk of it then, if it's going to go towards managing disease conditions that we can't treat, it's going to reach a situation where it's going to be near impossible to manage it.
And I'm glad you also mentioned in the perspective of helping to also understand what the magnitude of this problem. Before the break, you mentioned that gradually it gives a more overwhelming effect, even more than the COVID-19 that we had a while back. And so how does this awareness look like, especially now that we are already past the 2023 Awareness Week? How did it look like? And maybe what are the lessons?
Thanks, Mutegi, again. There are a series of things we did over the Awareness Week, and have been done over the last couple of years, since 2017, when I've participated in some of these things. One, we engage students. We have a very active engagement around students, especially university students, but we are targeting to go to lower levels, because some of the things that we need them to do is to understand, what do I need to do? And they're simple things. For instance, when you get sick, the first port of call should be a doctor who makes a prescription or finds out what's wrong with you, not a chemist like we commonly do. I go to a chemist, I say, oh, I want this or that, and I'm given. That's part of what we need to be looking at. So it's about engaging students to get them to understand where the problem is coming from, the magnitude of the problem, and what we can do. And remember, students are a good medium, and because they all come from communities. If I go to KU, all of you have a community or a county you come from. So if you get the message right, it goes down to mashinani, which is what we are looking at. The second thing we do is the media engagements, like now what we are doing now, where we then get opportunities to engage the nation through media platforms like this. And it's both the mainstream media and also the digital platforms, so you're getting messaging to go onto the social media, digital platforms, which people can interact with so that they understand, getting small clips. For students, we even have a student competition. What do they think we can do? What can they do? We are currently running an engagement where we're asking students to engage with their community, record it, and get it back to us. Then, of course, there's the scientific bit of it where we engage the professionals. We engage the medical doctors, we engage the animal health practitioners, we engage environment specialists, the fishery specialists, because this thing cuts across all. It's what we call a One Health approach. Our problems are coming from animals. The problems that humans are having are ending up in the environment. The animal problems are ending up in the environment. So we need to work together to ensure that all of us are trying to push to ensure that this thing doesn't get far. So we have scientific conferences and symposiums where we engage that. Then we also engage the policymakers, because you realize this is something that governments must take charge of. So in this year's high-level meeting, we had permanent secretaries from Ministry of Health, because of the human side of it, Ministry of Agriculture and Livestock because of the crops and animal side of it, Ministry of Mining and Blue Economy because that's where fisheries is, and the Ministry of Environment and Climate Change where the environment is. And all of them have come together to work hand in hand. The policy and the action plan has responsibilities that each one of them is going to look at so that we drive and mitigate against antimicrobial resistance so that it doesn't spread. And beyond that, we also engaging global organization, World Health Organization, World Organization for Animal Health, Food and Agriculture Organization, and UNEP, because again, they are the global bodies that then drive certain agenda within those specific sectors that AMR is seen to be in it. Then on the side, because WOW is just 1 week, we also have an active surveillance program where we are looking at what is the problem at the animal level, which products is resistance developing against, which species, is it chickens, is it pigs. Alongside surveillance, there's also the research pieces where we are trying to find research so that we determine the magnitude of the problem so that then we are able to see how best to tackle it. So the policy and action plan actually lays down certain things that we need to be looking at over the next 5 years, especially for the action plan, that then will drive the conversation and also the action that we are taking as a country or as part of the global community to mitigate against antimicrobial resistance.
All right.
Yeah.
You mentioned the government, arms and maybe fingers, or Ministry of Health and the likes. How do you think they have come into play with this now on the ground? And honestly, how have they come to support this cause?
Okay, I think first what we must say is that the national government has then taken time to put together a committee, the national policy as a committee called NASIC, National Antimicrobial Interagency Steering Committee, that then brings all these ministries together for them to see what can be done and to offer leadership in terms of how we manage some of these things, which donors are coming in and how do they then channel their activities through the action plan. But that is at the national level. Counties then have also followed suit because we have the 16th county was launched. The 16th county committee, they're called CASIX, was launched the other day. I think it's Kericho. In one of the engagements, counties are then now taking the messaging down to the ground. Remember that agriculture, livestock, health are all devolved functions, so they need to be dealt with at that level. So in 1 or 2 counties that have been part of, you find that the county governments have actually developed work plans which are mirroring the national ones, so that they're able to then engage the community, the farming community, the medical community, the practitioners, even the consumers like you and I who then fall sick, with certain messaging that then can raise awareness on what we need to do and how we need to do some of these things.
Okay, thank you so much for that. We have 1.5 minutes, but I want us to bring it home. From the aspect of One Health, how does the different aspects, human health, animal health, and the environmental health also come into play together to make sure we are fighting against this elephant in the room in the name of antimicrobial resistance?
I'm telling you, that's a good question, because as you realize, let's start from the animal side. Animals are grown in an environment. They are not grown in space. So if anything that we do, if we give medications to these animals that are not necessary, that medication ends up in the products coming from the animal. So you find it in milk, meat, and you find it as two things. You find it as antibiotic residues or antimicrobial residues, or you find it as resistant genes that the organisms have developed, which then can be passed through the environment, and research has shown that, or can be passed through the product to the human being. So that's the first stage that you need. So from an animal health perspective, we then are looking at mechanisms that stop the spread from the animal to humans. You're looking at things like good hygiene and sanitation at the farming level. You're looking at things like biosecurity, good biosecurity that ensures that the production system is not contaminated. From the human side, you're also then looking at what is it that we're doing that contributes. When I have products that I've used and they've expired, what do I do with them? Do I put them in a dustbin? Do I throw them in a pit latrine? Because that then contaminates the environment. If it contaminates,
do I force my animals to take it?
Yeah, if it contaminates the environment, if the animal then goes to graze and it's grazing on a pasture that has contamination because we threw antibiotics carelessly, that animal then picks that antibiotics and it gets into the food chain and gives us problem. The environment people are then looking at how do we dispose wastes? What do we do with manure? Because that then continues the cycle. If the manure came from a chicken house that had used antibiotics, it has antibiotic residues and resistant genes. And so that's why the 3 or 4 arms, what we call the One Health, the environment, the human, and the animal side of it are working together to ensure that whatever we are doing at each of those levels is to minimize contamination and to ensure that the spread of that resistant genes or the resistance is not spreading faster than we can manage it.
Wow, brilliant. My director, Frank Intenje, gives you another 30 minutes to take it home. Is there anything that we have left? At World Animal Protection, how can farmers get in touch with you? That's what I feel like is itching for me.
I think for World Animal Protection, farmers can get us through our social media platforms. They can also get us through our website, but they can also actively call us. We have an office sitting in Westlands in Nairobi, just behind Sarit Center, Westside Towers. We can come and have a discussion with us. But for me, the critical thing is that we actually work with partners at the ground because we are thinly spread. We are a small organization trying to manage processes across Africa. So we work with the veterinary associations, we work with the nutritionists, we work with the animal health technician associations, we work with Animal Production Society of Kenya, we work with governments, both local, county and national governments. We also work with academic institutions. So we are available at all those spaces. And critically is about looking at the connection between the welfare, how we treat that animal. Because when we fail to address the 5 fundamental freedoms that animals have, then we have a problem in our production system. That problem then contributes to antimicrobial resistance because farmers have discovered that I can pump in drugs to mask the poor welfare that I'm having. And in our estimate as an organization, 40 to 80% of the antibiotics specifically that we use in production systems are not necessary. If you give the animal good food, clean water, a clean environment, with good ventilation, and we did vaccinations and disease control using biosecurity, just ensuring that the animal is kept in a secure place where the contamination doesn't get to it. We would not be using antibiotics. But we're also saying as an organization that when the animal falls sick, it's a requirement of the Prevention to Cruelty Act, CAP 360, that the animal must be treated. And when you treat it, there are also requirements that say that an animal on treatment, the product should not be used. There's a withdrawal period. So if you observe these small things, then we are able to manage this process and even manage antimicrobial resistance.
Amazing. Thank you so much, Dr. Yamo, for joining us tonight. Most people in the world, it's the larger population that actually eats animals and animal products, right?
Yep.
As opposed to the other part of the demographic. So it affects us in a huge way.
Yes.
All right. Thank you so much, Dr. Victor Yamo, Farming Campaigns Manager at World Animal Protection. giving us content. One thing that stands out for me is biosecurity. I'm going to research fully on that as I'm looking forward to keeping a few animals.
Great.
and adding to the chicken that is already there. All right, thank you so much for joining us tonight. It's been a pleasure, and we hope to have you again. This conversation has started.